All right, I guess we can get it started. We're at 2 minutes past, right? So I'm sure we'll have people rolling in as we go. I'm going to welcome Dr. Melanie Cerrone. Um, and I'm so happy that she's able to do this for us. Melanie has taken some of my courses, and that's kind of how I got to know her. And I started seeing how kind and caring she is with her responses to people in the Facebook groups, and how how she replies and her empathy and her responses. So that had me cyber snooping a little bit more deeply. And she also has a background in ABA, and she is a licensed psychologist as well as has a PhD in psychology. And this is impressive, guys. So you guys that are in the training world, she is a CPDT. She is a Gene Donaldson grad. She's a CSAT. She's a Pat Miller grad, Fear Free certified. So she's got a whole bunch of letters after her name, too much to list in a signature block. um,
Yeah.
so I'm super excited that she's got like this, what I like to call like a dual skill set in terms of having the psychology background and all of the dog training stuff that a lot of us know. So she is acutely aware of all of the things that we go through as trainers, whether working cases with clients or whether the things we're all struggling with now. So I'm going to let her take it from here. And I'm going to mute myself and stop my video so I don't get in the way, but I'll be here to chat or answer questions as we go along if anybody has any issues.
Excellent.
Welcome.
Thank you, Mike. Thank you. And thank you for that lovely introduction. And thank you, everybody, for being here. I am really psyched that you are all here live. I know that this is being recorded, but for those of us who are here, I'm just so glad, just for the social connectedness piece. I know right now in my state, I'm in Pennsylvania, and we've been on a shelter-in-place order, as probably many of you are. And so it's been pretty isolating. So it's really good that we're here. I said in response to Mike's Facebook post earlier, this isn't a virtual dance party, but hopefully you have, a beverage and a snack, and we can talk and have some fun and just engage with each other for the next hour. So I am really excited to be here, and I want to, oh, there we go. Okay, I wasn't able to move my slide. So I really want to give a huge shout out to Mike, who has been just fantastic. And I've been so impressed with his just commitment to and awareness of the mental health and behavioral health needs of the people in the animal care profession and for the people who are in his groups. And so he's made a concerted effort to really reach out to people and to try to get some resources and information on counseling and therapy and what's out there as far as mental health and behavioral health. No, you shouldn't be blushing. It's true for the people who are doing this really challenging work. So hats off to Mike, and I am so happy to be here and to be a part of this, and that I'm doing this and that I'm here with you. So yes, Mike is awesome. Absolutely. So Mike went through my background a little bit, and I just threw up a slide. I'm here because I have some street cred from Mike and my association with him, but I just wanted people to know that I actually do have this, kind of background in psychology, and I've done a couple of things and have worked a few places. So I put up my dissertation. It was in the treatment of combat-related PTSD and guilt. And so the work that I've done throughout my career has really been very trauma informed. And I think that's so important, particularly now, to try to support people, particularly those in the animal care profession who are struggling. So I like I said, I've worked in inpatient settings, outpatient settings, corrections. I have a very strong background in behavior and cognitive behavioral therapy and applied behavior analysis. So a lot of informal training in that through the years. And then I decided, I guess back in the spring, to go back and get my actual certification and sit for the BCBA. So I have that in process as well, actually the BCBA. So that's a little bit about me and my counseling background. And then Mike went through a little bit of my dog training credentials and my behavior credentials. So I've done a few things there. But the hat that I'm going to be wearing today is my psychologist hat. And I have just felt so just really feeling for people who are really struggling right now. It is really scary out there. And when I started to see, people's posts and the difficulties and with everybody with just struggling with the health ramifications and the financial ramifications and the uncertainty of it all, I just really felt compelled as a psychologist to reach out and to do something. To give, to give back. So I'm so happy to be able to do that tonight. So a few objectives, and this is going to be really informal, but the first thing is just fostering connectedness. I'm so glad you're here. And I really want people to know that even though it can feel like it's very isolating and very scary and that we're very disconnected from each other, you really aren't alone. And we're going to be talking about ways to keep that connectedness going in this time. So for everybody who's here, shout out to everybody for that. It was just to show up tonight is a win. So I also want to talk about some evidence-based strategies for coping with distressing thoughts and feelings. So again, background in cognitive behavioral therapy, which is evidence-based for anxiety, depression, PTSD, and then also acceptance and commitment therapy, which is kind of like the third wave of cognitive behavioral therapy that's coming out of the School of Applied Behavior Analysis. So that's also just a fantastic evidence-based practice that is super practical especially right now in times of crisis. So I'll be drawing on both cognitive behavioral therapy and acceptance and commitment therapy, and then just to offer some support and some resources. So this is going to be super informal, and I have Mike on notice. I let him know that if he would help me kind of check the chat box, if you have any questions, you want to participate. I love to train live because I really like to engage with the audience. So any questions you have, comments, feel free to put them in the chat box. If I miss them, Mike hopefully will catch them. And so hopefully this can be informal and interactive, and stop at any time. Feel free to ask questions at any time. Okay, so I'm gonna take a drink here. Who's got stress right now? Oh my gosh, it is just overwhelming. And if we think about our lives just 2 weeks ago or 3 weeks ago, BC, so before the coronavirus crisis, if we think about just all of the stress and all of the things that we were juggling back then, it almost seems like kind of an eternity ago. I know for me, I was doing a class and juggling an internship and family and job, and so even though I'm doing things that I love to do, there's a lot of stress and a lot of anxiety. And this is just in our normal day-to-day life before this huge crisis hit. So I'm going to play a little video for you. It's only about a 3.5 minute video. And it's talking a little bit about just how we've kind of, as humans, biologically evolved to be predisposed to things like anxiety, stress, what they'll say in the video is psychological suffering, even in good times. And it's a little video from a gentleman named Russ Harris. He is from Australia and is one of the people who has done a lot of work in acceptance and commitment therapy and making it very user-friendly for the general public. And he's written some self-help books as well as training trainers or training therapists in acceptance and commitment therapy. So I'm going to play this little video for you. Hopefully this is more.
The human mind has evolved to think in such a way that it naturally so that you're better.
I am so sorry. Okay, so I'm going to start this over.
The human mind has evolved to think in such a way that it naturally creates psychological suffering. You see, back in the Stone Age, 200,000 years ago, life was pretty dangerous for our caveman ancestors. So if a caveman or cavewoman wanted to survive, their minds had to constantly be on the lookout for things that might hurt or harm them. And if that cave person's mind wasn't good at predicting, spotting, or avoiding danger, what happened to her? The default setting of the caveman mind was safety first. And we in the modern world have inherited this. Our modern minds are constantly warning us of things that might hurt or harm us. The caveman mind says, watch out, there might be a bear in that cave, you could get eaten. Watch out, that shadow on the horizon might be an enemy from another clan, you could get speared. Our modern mind then does worrying, predicting the worst, avoiding anything that scares you, anxiety in all of its different forms. Back in caveman days, you survive an encounter with a bear or a wolf, then it's useful to replay it. It's useful for your mind to go over the events and remember what you did to survive so that you're better prepared for next time. But in our modern world, we go over and over painful memories, dwelling on them, reliving them, even when there's nothing useful to learn or the lesson has been well and truly learned a long time ago. In the Stone Age era, as a caveman or cavewoman, you have to fit in with the group. If you are alone, you will soon die. So your mind compares you to others in the group. Am I fitting in? Am I contributing enough? Am I following the rules? Am I doing anything that might get me thrown out? Now, in modern life, we're always comparing ourselves to others. But the problem is we're no longer in a small group. Our groups are enormous today, and we carry with us devices that constantly feed us images and stories of people all over the planet. This constant comparison ramps up our fear of being judged or rejected or not fitting in or just not being good enough. The caveman mind tells you you need more food, you need more water, better weapons, better shelter. The cave people who thought this way lived longer and had more offspring. Unfortunately, in the modern world, this manifests as greed, dissatisfaction, craving, wanting. It's never enough. I need more, more, more. And if all of that wasn't bad enough, these Stone Age thought patterns are intensified by the sheer pace and complexity of modern life. Our frantic existence, rushing from task to task, that never-ending to-do list. So, when your mind starts doing this unhelpful stuff, as all minds do, remember, it's not defective or abnormal, and it's not deliberately trying to make your life difficult. It's simply doing the job it has evolved to do, trying to keep you safe and save you from pain.
Okay. So, and that's in good, relatively typical times. That's what our minds do for us. Any thoughts or anything come to mind for people as you were watching that, and how that may be impacting kind of what's happening with us now? And I'll just see if you have any thoughts. Feel free to type them in the chat box. The graphics, good. Okay. Felt relief. Okay, love the way they can, yes, versus modern scale. Yeah, absolutely. So it's adaptive, kind of our worries used to running. Yes, me too. Now I don't know what to do with myself, Lori. Absolutely. It sounds like we're all herding dogs, and it's kind of that thing. And I before all of this happened, I thought, oh, I'm running around all the time, with my hair on fire. Yes, so no wonder we're all overwhelmed, Joanna, definitely. Isn't it fascinating, Carly? I agree with you. I really think it is fascinating, and it is so interesting. And I think, it also kind of explains when sort of this pandemic hit, everybody was out doing the, the hoarding in the grocery store and the stopping up in toilet paper. And I think, that's a part of what was happening, we were sensing danger, fear, and we were kind of reverting back to those behaviors. Your brain is so good at predicting danger in regular times, now not so much. Yeah, feeling lost. Yeah, not knowing the unknown. Absolutely. Yes, Jackie, exactly. And that's when I saw this, Jackie, I thought the same thing. So it describes how genetic affects dogs. Guess what? We've evolved too. We're animals too. Yes, Nicole, absolutely. I will get the link to the video for everybody. Oh, and Jenny, we're going to talk about why people are not feeling like you're being productive. Okay, good. So I'm glad all of these things are on people's minds, and thank you all for putting that out there. So now that we're kind of in this corona crisis, got even more stress? Absolutely. So even though most of us for the last, couple of weeks have been sheltering in place and haven't been able to get out and go about our normal routines, the stress is just exponential given everything, that's going on. So thanks to the virus here. And so I think also what compounds it, and I know for me, oh, we can't see the chats. Oh, unless they're directed to the panelists and attendees. Oh, okay, Lee, yes. I will try to do that. So when you comment, it would be great if you click where it says to, the 3 little dots, and it will allow you to select all panelists and attendees, and that way everybody can see the comments. So excellent, and I will do that, Lee. So we have been just bombarded. Absolutely bombarded 24/7 with statistics and information and graphs and curves and so many sources. You can't pick up a paper, a magazine, turn on the television, look at your phone without being bombarded with everything COVID-19, and certainly the conflicting information and the reports out there, and who to trust, who not to trust, who to believe, what's going on, is just such a tremendous source of anxiety. And somebody in the chat box mentioned uncertainty and fear. And if I hear one word that people seem to be the most concerned about, it is just the tremendous uncertainty. So all of what we are going through, all of those feelings are so normal. We are all going through them. It's, yes, Joanna. So Joanna's saying she's having a hard time quieting her mind to sleep. Absolutely, that is completely expected. So here is our brain on coronavirus. So if we were stressed out and nervous and anxious about things before and trying to keep up and comparing ourselves, it has just been compounded exponentially with this virus. Nighty Night Tea has been a lifesaver, says Courtney. And Kelsey says, yeah, I feel so overwhelmed. Absolutely, and we're going to be talking about that. It was interesting. So I was putting this this presentation together and trying to get some slides together, and I took a little turn here because I was going to start talking about coping, and then somebody mentioned this that they feel like they have not been able to be productive. Anybody else feel that way? We have all this time on our hands now, all of this free time, because all of us are home, and yet I know for myself, my productivity has been just terrible. And Samantha says yes, even though she's cleaning nonstop, so kind of busy work, keeping yourself going. Can't focus. Yes, Tegan, absolutely. Productive at following more info. Absolutely, Abby. So yes, wanting to scroll through, not miss anything. And that's where I was the first few days. Melanie says, finally time to train our own dogs. Some people are able to be productive, and that's great. Christine says, much less productive than I expected to be. Absolutely. Oh my gosh. Justice says, I feel the pressure to make the most of every single minute and compare myself to 9-to-5ers who are still working from home and making a regular salary. Absolutely. Janine says, I have so much I want and need to do that I actually feel overwhelmed and the pressure to get it done. I am right there with you. It was so hard for me, and this will be true confession time, and I was going to talk a little bit about this. Pulling this together for me was excruciatingly difficult. As much as I wanted to do it, and I know this stuff, I've done this stuff for 30 years. It was painful. I had a lot of difficulty trying to just sit down and focus and be productive. Karen, too many thoughts, hard to organize. Absolutely. Virginia, oh my gosh. Went to the grocery store today and I was exhausted. Yes, I am so there with you. There are just so many days that, I think, okay, I made it through the day. I have two boys, 16 and 17, and my husband. And so there are just some days, and then my animals, I have 3 birds and 2 dogs. And I think, nobody bled out today. So it's a good day. We're winning. Basically, we got, everybody got something to eat and we survived. Oh, Joanna, it's nice to hear that you feel the same way as me. I do. This was tough. We are all in this together. And that's what I wanted to this is where my presentation really took a turn, because I wanted you to know that what you're feeling is very typical, very normal. There's actually this thing I started to seek, because I'm following the American Psychological Association groups and the Pennsylvania Psychological Association groups and other therapists, this productivity anxiety. And it's this anxiety stemming from this pressure to be productive with all of our new found free time. And there are people, and kudos to you, who have gotten things up and running. They've gotten online classes going. They have revamped their website pages to be able to market their new classes. They're doing new class curriculums and training plans. And I have a network. I'm involved with a network of just some fabulous trainers who not only have done that for themselves, but they have pulled that information together and they're supporting other trainers and behavior professionals. And they are amazing. And Karen says, good example of trigger stacking. Yes, absolutely. So much to manage. And then not only do we have this pressure to do, get all of our businesses kind of online and running, and kudos to Mike again for doing the webinar on doing aggression consults online. But you'll see on social media, now's the perfect time to, Marie Kondo your whole house and learn 5 new languages and teach your dog 15 behaviors and scrapbook all of your kids' baby pictures. That's me. Seriously, that was so helpful. Oh, good, Carly. And do everything that you've always wanted to do but never had the time. And if you're anything like me, I have about this much bandwidth right now for any of that. And so it can lead to this, here's the fantasy. We're going to be productive. We're going to sit at our offices and be on the phone and have our coffee and our books, and we're going to be, getting it all done. And if you're anything like me, this is the reality. So that's me in my pajamas, all these things going through my head, and really hard to get it all together and to feel like, okay, I can, I can execute all of these things I'm supposed to. So a little self-disclosure here. The nice thing is I'm not doing therapy, so as a psychologist, so I can put this out there and to just share with you a little self-disclosure. Yes, stress eating. Melanie says it results in stress eating. It does, and we're going to talk about that. And truth, you feel guilty watching TV. I am right there with you. It's easy to start, but then I get distracted by what my mind says I should be doing. Yes, Crystal, that is exactly it. Mason, I've been trying to emulate my reactive dogs. When I feel anxious and have racing thoughts, see a stranger dog, that's my cue to focus on my breath, especially the exhale. Slow it down a bit. Disengage, settle on a mat. Yes, Mason, virtual high five. I know we're not supposed to be, we're physical distancing, but absolutely good for you. We are going to talk about some techniques, some breathing, and some disengagement from all of this. Yeah, I am totally with you. I've had the one day I got up and breakfast and lunch happened to be, a big sort of bag of Hershey's Kisses. So I am right there with you. And then some people, Jenny's saying she's overcompensating with other things. So over exercising. Yep. So we're going to be talking about that. So yesterday, I finally sat down and I wanted to do this. I wanted to be here. I wanted to give back. I wanted to provide support. And so I knew I was going to be doing this for a week and a half, 2 weeks, Mike, I think. And I'm sitting at my computer yesterday from in the morning, and I'd waited until the night before to pull these together because I thought, okay, you know, I'll be able to do this. And I looked at my phone and I realized it's 1:15, and I sent a text to my friend and it says, I'm still in my pajamas and it's taking every ounce of everything I have to do this PowerPoint. This is not the perfect time to do anything. And I'm going to tell people that. I'm going to tell them it's okay to stay in their pajamas and not brush their teeth right now. And I got this back from a friend, and her response was just a very enthusiastic yes. Yeah, so Reese says, working from home, yep, and feel even more tired than when I had to drive back and forth to work for an hour and a half. I am right there with you. Absolutely. It is exhausting. It is really, it's physically, you know, exhausting. So this is the little thing that then my friend texted me later, and I had to share it with you. And excuse me, part, you know, for the curse in here, but it is really true. So if you are on social media and you are looking at people's to-do lists where they have checked off the 15 things they've done, and they're showing you their beautifully Marie Kondo drawers and closets, it is okay not to be your most productive during a global crisis. Your favorite word. Oh, I'm glad, Jen, and I'm glad, Jenny, that you love it. Awesome. Gardening is the only thing that makes you happy right now. Nancy, do it. Yes. Oh, Brittany, you're welcome. Yeah, what a wake-up call. Thanks for sharing that. Yeah, and you know what? And we're going to be talking about this in a minute, workability. If it's working for you and you are those fabulous people that have been able to pull it together and you know, get your things together and get your websites up and running and do it, that is fantastic. But for those of us who haven't been able to do that, it is okay. This is some real stuff. So if you're getting by day to day and you're not bleeding out and your family's not bleeding out, consider yourself, it's a win. So I had a hard time just being here. My goal for today was just to show up, because I'll tell you, I was struggling yesterday getting this. Oh, good. It's so nice to know I'm not the only one that's struggling. Nope, I am right there with you. And you know, end of the day yesterday, I'm thinking I may have to tell Mike, oh, I don't know that I can pull this off. And I thought, nope, we're going to do it. I'm showing up. If that's all I have to do, if that's all I do, and we just connect and we spend some time talking, then that's good. Shauna, need to stop feeling guilty about not getting anything done. Yes, absolutely. Be good to yourself. Be compassionate and kind to yourself. The nice thing is I'm starting to see some of this on social media. So I saw this yesterday. This is from Lynn Bufka. She is a psychologist and one of the directors of the American Psychological Association, and she did an interview with CNBC. And she was talking about this productivity pressure and all of this pressure online that we're experiencing and that we're seeing when people are posting all the wonderful things they've done, or what we all should be doing. Now is the perfect time to whatever. Stop and think about this. And we know this in our heart and in our heads, but we've got to feel it here in our hearts that we know most people curate themselves and put their best on social media. So I do too. You know, when I post videos of my business, I want to post the successes and the dogs that are doing great and the clients that are having success. But what we're not seeing is the mistakes and the flubs and the errors. We're seeing what people want the world to see about them. So if you're looking at that and you're thinking, that's not my life, bear in mind that's not most people's lives most of the time. Okay, so just be clear that what you're seeing on social media doesn't reflect the reality for most people. Mike says guilty. The blooper reels, yes. And I throw in some blooper reels every now and then. It's a lot of fun. Thanks for pulling it all together. Oh, Crystal, you're welcome. Thank you for pulling it all together. Samantha says, I appreciate you showing up. Thank you. I'm so glad you guys showed up. So forgive yourselves. Be good to yourselves. Don't feel guilty. The key, one of the things I want you to take away from tonight, a couple of key words. One of them is going to be workability. So ask yourself, is what I'm doing now working for me? If it is, then you know what? Good. So if you are able to get, all of your stuff done and be very productive, fantastic. If for you workability is getting out of bed and maybe brushing your teeth or answering an email, that's it. That's good too. So what are you doing? Is it working for you? And think about too, is it helping me and my family, get through the crisis in a way that's constructive and healthy and aligned for my, with my values. So that's something I think about when I see on social media. We are all scared and stressed. And these times bring out the best and the worst in us as human beings. And earlier at the start of this, New York was applauding the shift change and the first responders and the nurses and the physicians. And these people are true heroes who are going out there every day and working. And they deserve those kudos. And so, for us though, in our own small way, are we able to kind of get up and do a little something, no matter how small it may be, for ourselves, for the people in our families? And maybe if we have the bandwidth to reach out to somebody else, in our community. Carly says, so I'm definitely the person going a mile a minute and being super productive. Good. Okay. Yeah. Because it's logistically an absolute freaking necessity in order to keep my family above water. Yeah. Yep. But I have the same crushing anxiety when I'm doing it and no time to slow down and do the other things or nothing. So what do you recommend for that? So we're going to be talking about doing some mindfulness stuff that can be so helpful. So if what you're doing is working for you, keep doing it. That's great. And if you're staying in bed all day and or you're like me, the first couple of days I'm in my pajamas and eating my Hershey's Kisses for breakfast and lunch. By the second day though, I realized, okay, maybe this isn't working so great. So consider taking some committed action. We're going to talk about what that is. Small steps, something just so small. To help you feel better and to cope more effectively with what's going on. I like your meal choices. Pretzels for me, says Abby. Oh, it's chocolate here. So if we think about what we saw in the video, about our brains and how we are predisposed to psychological suffering, or I like to say stress or anxiety. A lot of times with coping, when we're taught coping skills, and even in traditional cognitive behavioral therapy, we're taught to reframe our thoughts, change them, that they're somehow dysfunctional. We're taught stress reduction, so we want to reduce them. We're taught stress management. It's all about avoiding, escaping, getting rid of those thoughts and those feelings that are so uncomfortable for us. And what Carl Jung said, and he's an old psychoanalyst from back in the early 1900s, kind of Freud's time, what you resist not only persists, but grows in size. And this has to do with those negative thoughts and our feelings about ourselves. So these feelings, these worries, we can't avoid, escape, or stop them. Okay, again, we're biologically prepared to have those kind of come in and bombard us, even in good times. If we think about it, even when our lives are going well, we're worrying, are we keeping up with the next person? Is this really enough? What more can I do? So we can't stop them. And to try to do that, what happens is if we manage to escape them, it's typically only temporary. And sometimes when they come back stronger. And this can be how people end up in behaviors that are, not so adaptive. So things like addictions, numbing out feelings and distressful thoughts with alcohol or drugs or gambling or sex or food, or sort of mindlessly scrolling through social media, or watching, 6 hours of Netflix. All of these things to avoid escape, to forget. Okay. Yeah, so you have some great, can you ask them in the chat? Okay. Oh, good. Okay. So question. Okay, I'm just taking a quick look at the questions. All right, Sam, clenching teeth, go to work every single day. My daily routine besides my weekend hasn't really changed that much. Why are you feeling so overwhelmed? It is because, again, we are being bombarded. There's a lot of uncertainty. And even though you're going to work every day, there's probably a lot of concern about, what are your underlying concerns? How long is it going to last? Is this going to affect me? Is it going to affect my family? How is it going to impact me? And some people, Kelsey is also saying she doesn't want to hear about it. I agree. We're going to talk about unplugging sometimes, taking it in small doses, not being so immersed in it. Okay, so what we want to do for effective coping, we can't stop this. We are being, there's a bear there. There really is. There's this crisis, this thing that's very scary. It's not sort of anxiety where it's just kind of a generalized, I'm worried about something, but there's no real threat. There is a threat. We know that. The key is, and this is the kind of the heart of acceptance and commitment therapy that comes out of behavior analysis, is to notice and acknowledge and accept that the thoughts and feelings are present, even though they're distressful, and then to act in spite of them. So to not be incapacitated by them, or to expend a lot of time and energy trying to get them to go away, because we can end up in this tug of war with these distressing thoughts and feelings, where the more we struggle to get them away, the more we fight to vanquish them, the stronger that they come back and they persist. And so sometimes it's a matter of just dropping that rope. Instead of playing tug of war, we're going to drop the rope. We're going to get control by giving up that control. And we'll talk a little more about that as well. So the key is to focus on what we can do. It's just, as human beings, just the way we're built. We can control our outward behavior, our actions, our behavior, our responses much more easily than we can control our internal thoughts and feelings, which is what Skinner and radical behaviorism, all of these things, our emotions, our feelings, our sensations, our thoughts, are all private behaviors. So they're actually observed, they're private because people can't see them, but they're behavior. And so we know we have more control over the things that we can do and see, our actions, than what's going on in our minds. So focusing on what we can control, it's not going to change the fact that there's this global pandemic. What we want to do is hopefully to help us to be able to take care of ourselves and our families, those who depend on us, and maybe even reach out to the community, and to make a significant difference. So to control what we can. So a couple of things to do is to really consider, we've never kind of faced a crisis like we're facing now, but we've all been through difficult times and struggles. And so what actions have you taken in the past in other crises that you found to be helpful? What did you learn from those situations? And what small, simple, easy steps can you take in the next few minutes, the next hours, or the next day? So these are the things to think about. Yeah, watching all the news and and everything. People can't watch the morning news. Absolutely. pull the plug, unplug. It can be so, it can be debilitating and incapacitating. So what we want to do is take some values-guided action. And so these are actions, these small things that we can do are observable behavior that are guided by your core values and your values that, you know, we want to live by. So these are taking actions that are going to be important to us as people and as who we want to be as individuals and humans. So think about, as we're going through this, what kind of person do I, you know, want to be as we go through this crisis? You know, how do I want to treat others? How do I want to treat myself? How can I respond in a way that I'm going to feel good about this when all of this is over? Because it's so easy. It brings out the best in us. These crises, it can also bring out the worst in us. And I've seen some, you know, obviously with the hoarding and the scams and the people who were, you know, selling masks at a ridiculous price at the outset of this crisis. And Kelsey, yes, if you have to leave, take care of you, bow out, walk away, and come back. Okay, nope, doesn't mean you're an ignorer. It means that, no, not at all. Take care of yourself. So if it's overwhelming, absolutely give yourself permission, workability, and flexibility to do what works for you. Those are going to be huge things, to be flexible. So kind of looking at it, just at some values to kind of guide us through this when we're acting. If we're on social media, it can be so tough to respond to people in this time with, you know, with respect, with compassion, with kindness, because along with all the good stuff and the people out there that are really doing heroic things, we see people doing things that are, you know, just pretty awful. And so how we respond to that on social media, how we respond to each other, it's so important to take a look at that, and to think about what actions are going to guide me through this. I was listening to a webinar with a group of psychologists, and they talked about having families sit down together and talk about, you know, what are our values as a family? How are we going to get through this together? What kind of values do we want to consider, and even come up with kind of a family coat of arms where you actually write out, particularly with younger children, kind of the values that are going to get you through as a family, and how you treat each other and treat people outside your family, you know, in this time. And then coming up with some SMART goals. So we were talking about taking action and goals. And one of the things that I like that comes out of ACT are setting SMART goals. So if you're like, and I set a SMART goal for this webinar. Oh, and Janine says she has several accountability partners. Yes, that you check in with daily, to eat well, exercise, reach out to the other person. Absolutely. That is excellent. So reaching out to others. So so your SMART goal, what specific behavior are you going to do? Make it observable and measurable. If you want to do something for yourself, for somebody else, say you're going to do an act of kindness or compassion. Motivated by your values. So what value? So today I'm going to do something kind, you know, for myself. Make it specific. So what is that? I am going to make myself a healthy breakfast. So instead of eating my chocolates, I'm actually going to make some egg whites, or I'm going to make a healthy smoothie. Motivated by my values. So my values being, you know, kindness, compassion to myself in this case. Adaptive. So is it a wise choice? Is it going to improve somebody's life, or your life, or somebody else's? So in this case, yes, it is. Be realistic. So do you have the time, the resources, health, social support, knowledge, bandwidth right now to accomplish the goal? So make them, you know, small so that you can do it, and then time frame, put a specific time on it. All of these things can be setting these SMART goals, setting these small objective goals for ourselves that are in line with our values and who we want to be as people, can help us to take action through this crisis so that we're not feeling so immobilized. So my SMART goal was showing up. So specific, what behavior are you gonna do? My SMART goal was, I'm gonna show up here at 7 o'clock, whether I have 1 slide or 10 slides. Oh, remind me what bandwidth refers to. That's a great question, Janine. So it really is, do I have the emotional resources? Do I have the, do I have it in me to do this? Do I have the energy? Am I able to focus? Do I have enough internal resources to pull it together to do the goal? Because my goal, if it's not something that I can reasonably accomplish, if I don't have the internal fortitude to be able to do it, then it may be a great aspiration, but if I'm not going to be able to actually, pull myself together to do it. So I knew, for example, today that I had the bandwidth, I could pull myself together enough to show up at 7, no matter how many slides I had done. I figured I can do that. Motivated by my values, so motivated by me wanting to come and give back, acting out of kindness and compassion for people who I know are hurting, wanting to connect with other people. Adaptive, was it a wise choice? Yeah, I think showing up was a wise choice for both me and hopefully for other people. Was it realistic? Yeah, I figured I have enough bandwidth, I have enough resources that if nothing else, I'll be able to turn on my computer at 7 o'clock and log in and put up whatever PowerPoint slides I had. And then time frame. So yes, 7 o'clock, I knew I had the time. And then that I would be here 7 o'clock on Friday. So those are SMART goals. One of the things that you might find helpful is to maybe set 3 small SMART goals a day. So maybe if you have the ability to do it, maybe 1 small thing for yourself. So maybe 1 kindness that you're going to do for yourself. Maybe something that you're going to do for your family, whoever happens to be, sheltering in place with you. And then maybe something for somebody in the community, if you're able to do that. It can be 1, but just and small. Keep them small and reasonable. It can be something as, I'm going to show kindness and compassion today to my family members by just reaching out and just giving everybody a hug, by just telling everybody that I love them. It can be that small. It might be, I'm going to pick up the phone and call, my aunt so-and-so who I know is living across the country, and she's elderly, and I'm just going to reach out and say hi and tell her that I'm thinking about her and check in with her. They don't have to be these big monumental goals like I am going to totally revamp my entire website. So these are some of the little actions that we can take to help us cope. So what happens, and we've talked a lot, and I've had a lot of people say, that they sometimes just get so caught up in the emotion. So it's kind of coping with this emotional storm, coping with those feelings. And I have that swirl there of all of the kind of feelings that can just get us and take us downwards and kind of just blow us all over the place. Oh, Samantha, that's beautiful. Don't feel bad for asking for help if you don't have the emotional resources. Yes, absolutely. That can be a SMART goal for you. If you need help to actually go through those steps and find and take that action. That is an action. Nancy, my other profession is teaching. We were giving directives to do some really big tasks this week, and I've barely begun them. Yes, this helps to explain why I can't even pick those balls up. Absolutely, Nancy. So what you can do is set a SMART goal. Is there a task that you can do? Break it down. Maybe it's not even the whole task. Maybe you break it down into part of that task and you do what you can do. And people do want to help, absolutely. So you can use that kind of committed action to find, are there ways to help? And it can be tough because we're sort of stuck inside. But I have a friend who's an executive director at a nursing home, and they were not accepting letters or cards or pictures that children were drawing because they were concerned, very vulnerable population. They didn't want to take any chances on anything coming in through the mail. But they asked people to make it, and children to make artwork and pictures and to photograph it and then to upload it to their website, and there was a link. And then the staff printed out those pictures and they shared them with the people in the nursing home. So it was a way to extend yourself and to help and to do an act of compassion for somebody else. So if you're coping with these emotions and you're starting to get overwhelmed and you're just feeling like you're at the computer and you're starting to feel like I'm overwhelmed, I'm going to panic, one of the things that we're going to do is we're going to talk a little bit, it's a mindfulness technique, ACE. So the first step that you're going to do is to acknowledge your thoughts and feelings. So in ACT, in acceptance and commitment therapy, remember, we're not going to try to push those thoughts away because we'll never outrun our thoughts. We'll never get away from them long enough. But if we can accept them and accept those feelings, notice them, name them very gently, just sit and consciously think if you're starting to feel just overwhelmed and just taken in, what's going on? Okay, I'm noticing anger. I'm noticing anxiety. I'm having thoughts of worrying about money. So it's that first stop of just acknowledging. Don't try to escape or avoid or suppress, because that can get you into that whole, tug of war with your emotions. So while you're doing this, and you're going to connect with your body. So you're going to try to get physically grounded in a way that's comfortable with you. So you're going to kind of drop anchor. So if you're out in a boat, and I used to boat in another lifetime, and if we saw a storm coming up in a sailboat, what we would do is try to get into a safe space, get into a safe cove and drop anchor and get grounded. So you're going to connect with your body, get grounded physically in a way that's comfortable, to kind of, again, not to try to suppress or avoid what thoughts and feelings are going on, but just to get in touch with your body. So you can stretch your arms straight out or over your head. You can slowly and gently stretch your neck, roll your head. You can take several slow, deep breaths, like the gentleman earlier had talked about. You can slowly just clench and unclench your fists. Stand up and stretch. You can press your hands onto your desk or your feet into the floor. Again, you're going to be remaining aware of your thoughts. Those thoughts are going to be there. You're going to notice them, but you're going to act in spite of them. And then you're going to engage with your environment. So kind of bring yourself back. Name 3 things that you can see around you. Name 3 or 4 things that you can hear, something that you can smell. Name something that you can taste. And then once you've kind of reconnected, you've dropped anchor, you're kind of out of that storm of emotions, you've noticed them, those, the feelings are still there, the thoughts are still there, but they're not going to kind of just blow you all over the place. You can end by going back to your task at hand, or you can set a small, smart goal to do for yourself or to do for someone else. And Samantha says, can pets help with this? Absolutely. So again, kind of acting in kindness and compassion, and what are our goals for our pets? So I might not have the emotional reserves or the bandwidth to train my dog to do 15 new things. Maybe I can do, work on one small thing, and that might be realistic and attainable. So then we're going to kind of talk about so that's kind of a mindfulness exercise, doing the ACE and dropping anchor. We have setting our SMART goals. And then one of the things that can kind of help us to just feel a little more in, I think, just in control of everything is to identify just a couple of reliable sources of information. In the stream, in the chat, people were saying they just felt overwhelmed and bombarded. And there are some, we may still want, and maybe you don't, and if you don't, that's okay. But if you want to keep up on what's going on, some of the reliable sources of information are, the CDC website, the World Health Organization, Johns Hopkins has a coronavirus resource center. And if you go on the web and you click on any one of these links, if you haven't already, you'll see that they have the coronavirus site is the first thing that's popping up, so that you're able to get reliable information if you're interested about, the spread and transmission and what the statistics are, but you don't have to do that. One of the things that is, you may have to do and is important to do is to kind of keep in touch with what's going on locally, because things change. So is a social distancing order in effect? Has that changed to a shelter in place order or a lockdown? So you do have to keep in touch to some extent with what's going on in your community. But again, unplug when you need to, and then base your behavior on that accordingly. So, okay, we've been in a shelter in place, so we're only allowed in our area to go to the grocery stores or to do some essential things. And then again, schedule or limit your news time. Can be really helpful. Routines, if you can, and again, remember the two key things: workability and flexibility. Does it work for you to set and create a schedule, and keep it flexible? So this can be helpful for both adults, and if you have kids at home, and I have 2 teenagers, and right now they're on spring break, but right before this week, they had a week of online classes. And so it was good to have them getting up at a certain time, taking class from 8 to 12, doing homework in the afternoon, and then going to bed. So it can give a sense of just sort of normalcy and predictability, even when things are really uncertain. But it can be loose and flexible. And, schedule in some of those things like social media time, because again, the endless scrolling on social media can be really overwhelming, and sometimes you just need to unplug. Put in exercise time. You can put in time to do your mindfulness and your breathing techniques, and kind of doing that ACE exercise. You can do that kind of dropping anchor. You can practice that. The more you practice that, the better the better you're going to be at it when you are in the midst of some really, a sense of being overwhelmed by your emotions. And then stay connected, as much or as little as is going to be helpful for you. Okay, so we have the great things. Technology is a blessing and a curse in some ways. So we can keep in touch through FaceTime, Zoom, Skype. There's Google Hangouts, text or messenger. You can go old school and pick up the phone and talk to people. In our house, when our kids were little, we did family game night. So we would have a night or two during the week when we would all get together and we would play board games or do puzzles. And we've reinstituted that with our guys who are 16 and 17. And it's given us time, because otherwise we can kind of all go to our own corners of the house, but it's given us a way to connect now that we're so socially disconnected from our communities. Or just read together. Sometimes we just get our books and we just all go in the same room and just read together. And Mason says, yeah, it's tough for introverts because all of a sudden there's much more emphasis, anxiety around connection. So Mason, absolutely. And I've seen, sort of memes that for, introverts, this is, kind of a great thing, that you don't have to kind of be out socializing, but do what works for you. So if staying connected isn't something that's, that's helpful for you, then make it workable for you. So if the connection is something that's going to be helpful, again, this is kind of in general stuff. So in general, what the research shows is that, psychologically, if we're isolated, in general, we tend to do poorer. We are, psychologically healthier, emotionally healthier if we have these connections, but a different, it's an individual thing as well. You've been talking to Samantha, you've been talking to your parents more than usual. Yeah, and if that's, again, and we may find ourselves doing things that, more or less of certain things than we have been in our, BC before coronavirus. And so again, is it workable? Is it a positive? I used to say I didn't have time, so it's good. Excellent, yeah, and I'm sure they appreciate it as well. Take a social distance walk if you're able in your community. I see there's tons of people out now in my neighborhood walking, and there are two women that always just walk together same time very early in the morning, and they're still doing it. They're just walking on other sides of the street, and I notice them on their phones, so I think they're talking to each other on their phones as they're walking. Great way, if you're so inclined, to stay connected. Facebook and social media groups can be good things, can be not so good things, depend on, what's going on, maybe in small doses. Give yourself permission to limit, mute, unfollow, unfriend, okay? These are some tough times. And so, taking a break from all of that can be really super helpful. Try, again, as much as possible, you'll see the experts say, maintain a healthy lifestyle. Try to get enough sleep. So, kind of going to bed at the same time each night, trying to get up at the same time in the morning. Melatonin, yeah, yep. Abby says, yeah. Connect with nature, yes, Melanie. Yes, it's spring. The bird songs are beautiful. Oh, how amazing is it to have, the windows open and feel the air coming in and hear the birds and all the smells. Even when it's raining, it's nice to get that smell. Yeah, getting to sleep at night is impossible. Yep. Oh, it was snowing, Samantha. For Samantha, yeah, we are alone together. I find real comfort in that fact. Yeah, absolutely. So exercise if you can, eating as well as you can, doing your mindfulness, deep breathing, relaxation. My goal, I was hoping to have a list, and I am going to get a list of resources together for people on some mindfulness activities, relaxation activities, and some links for you to do. I was hoping to have that. I don't drop anchor. Yes, I will get that. I can actually have some worksheets I can put together. And I think what I can do, Mike, is put it in a Dropbox file and give you the link. And if you can post it, I know you're going to post the recording. If you could post the Dropbox link to when you post the recording, then people can access the resources. I apologize. I showed up, but I didn't get the resources section done. Mike says, perfect, great. Yeah, I'd love to have the ACE to put on your fridge. Excellent, yay, good, okay, great. Yeah, so do those things. Insight timer. Oh, tons of free short meditations, Janine. Insight timer, tons of free short meditations. Great, it's all, thank you, Shauna. It's okay, you're here. Yes, thank you. Sounds True has a daily resilience compassion video. Yes, a lot of meditation compassion teachers. Excellent. For Reese, it's been snowing since yesterday, but the robins are back. Oh, thank you for offering both. I want all my colleagues to experience this. Excellent. So yeah, get outside if possible, while social distancing. And then if you need to, reach out for help. So Mike did this fabulous thing. I hope all of you know this. Came out of his contacts and just being in touch with trainers and other behavior consultants and professionals who were struggling doing some of the really tough work that we do every day. And so he gathered a list of people in our community, myself included, who are resources, who offered to be resources to people who needed, some help. So there are on this list, and he has the list available both in his on his personal Facebook page as well as in his Aggression Masters course group. So there's a list of individuals. I added some things to it, including, you know, some of the next slides you're going to see information from that. Mike is so generous and has an arsenal of great friends. Yes. Oh, good, good, excellent, Mike. Thanks. Yes, we'll put that in that Dropbox links as well. Absolutely, share with your dog walking colleagues. Good. Janine says, if you don't practice meditating, do not be afraid. It gets easier, and it doesn't have to be. I love that you said it can just take 2 minutes, Janine. I was all about, when I heard, you know, mindfulness and meditation, I was thinking, okay, great. And I had in my head that it's, you know, that exercise where you take a raisin and you look at it and you examine it for 20 minutes and then you notice everything about it and you put it in your mouth. And I just thought, okay, that's not for me. I just, you know, I'm more action oriented. I can't do that. Samantha, I'm glad you're laughing at that, but it's not that. Mindfulness doesn't have to be this, you know, kind of like this big, all-encompassing, hours-long, sit like this kind of a thing. It can be 2 minutes. It does get easier. It's just kind of noticing. It's doing that little ACE exercise that I talked about. That's mindfulness too. But if you are in crisis, so I always put this up there, if you're in crisis, if you are overwhelmed, feeling like you can't handle it, you are having thoughts that I just don't know if I want to go on, I want to live, and I know suicide can be so taboo and verboten to talk about. If you or anybody you know, particularly in this crisis, are having these thoughts, please reach out. Help is available. Call 911, go to the nearest emergency room. Somebody who's experiencing suicidal thoughts, that's as legitimate of an emergency as having a heart attack or a stroke or, you know, any physical ailment. So that is a physical danger. So please reach out. This is a link that you can click on, and this will be available in the Dropbox link in that resources section. So it'll have an active link. You can click on that link through the American Psychological Association. They have a help center crisis line. You click, it will give you the information for a hotline. Yeah, Janine, she says it's an opportunity for all of us to learn to be uncomfortable with being uncomfortable. And that's all about what acceptance and commitment therapy is and ACT. It's just, yeah, I'm uncomfortable. And being able to take those small actions in spite of being uncomfortable. Oh, look at Mike. Yes, good. Yes, Abby's right. A local hotline crisis may be in your area. Definitely. So we're going to have in the resources section as well, we'll have some other links. So with the American Psychological Association, how do I know I need help? If you are really feeling overwhelmed, there's a prolonged sense of helplessness, hopelessness, real struggle, you're not getting any better. And right now, all of us are having some difficulties, you know, concentrating and working. Excessive worry, your actions, you're drinking too much alcohol, using drugs, doing things that, you know, aren't, you know, are not adaptive, aren't affirming. Reach out for help. The fabulous thing is, and I love this, New York, I'll tell you, people are just going above and beyond. I believe they have 10,000 mental health counselors, psychologists have volunteered their time and their effort to help the citizens of New York, even individuals who are not in New York State. The beautiful thing that's being worked on right now is that telepsychology, because of this crisis, there is moves at the government level to really open that up to people across the country, and also for there to be interstate compacts so that psychologists in a more populated area can do telepsychology and teletherapy with individuals in other states where they may not have those resources. Yes, NAMI, absolutely. Oh, Mike says, yeah, he saw that. Such great news. It was great news that this interstate compact right now, it's temporary and it's still not every state has it. Your mental health provider will know. So how to find help. So definitely, check your insurance company's list of providers. You can ask your family physician, close friends or family members, your county mental health office or Center for Behavioral Health in your county. Search online for psychologists, social workers, professional mental health counselor. The American Psychological Association has a locator service, and the National Social Worker Association, there's a finder service for social workers. And you're right, yeah, this forced isolation is very triggering for addicts in recovery. Yes, it is. And there are ways, again, people are really going above and beyond to reach out as supports. And so more individuals are able to get help online. These hotline numbers, they will be included in that resource. So Alcoholics Anonymous is here, Gamblers Anonymous, Narcotics Anonymous, the National Suicide Prevention Lifeline. Most counties have their own county crisis intervention service, so look that up in your area. So there is help out there. There are ways to get help, and I encourage everybody to do that. Okay, how did I do that? Okay, screen sharing has stopped. Anyway, I am out of my PowerPoint. Questions, thoughts, comments? Mike, anything you want to add and chime in?
I want to add that was amazing.
Oh my gosh, out. Thank you.
I'm so impressed, and that was just such an amazing presentation. And so thank you so much for doing it. Just yeah, I'm blown away. I'm speechless. And I have to say also too that like halfway through, it's like it was that excuse like somebody's cutting onions in my house, because I was literally tearing up at how supportive you guys are to each other.
Oh, I loved it. Oh gosh.
And you see some familiar names in here too. Like there's like previous students and like co-students, and it's just so like amazing that you guys are so supportive of each other. The chat box has been like the most wonderful thing I've seen.
Wasn't it?
All things started. So thank you guys, really. Everybody who's attending, amazing.
I know, this was fantastic. Thank you, everybody. And I am sorry if I missed your comments. If I apologize.
I think you got to them all. Like you're a pro at hitting those chat comments.
Oh my gosh, thank you, Mike. I was trying to kind of do that. Is it shareable? You'd like to share? Oh, thank you. And Mike, you're gonna,
Yeah, this will be up as a recording. I will make it shareable, and the chat comments will also be, if you want to share those, they can be done as well. So
fantastic. Yeah. Guys, I can't tell you, this really has meant so much to me, and that everybody reached out and helped each other. And Mike, again, you really are what you've done in the last, week and a half with your, when shit hits the fan series.
Yeah.
That is
I know, I appreciate it, but it was really all you. You're the one that came forward and was like, I would love to do this. And so thank you so much. Really amazing.
Guys, thank you. Message me if you have any questions through Messenger. And again, I will, one of my SMART goals will be by tomorrow at this time, I will have that Dropbox link with resources to Mike so that he can get that up there. And we may need a surviving COVID-19 Facebook group. Together we can be strong. We are stronger together, absolutely. So flexibility, workability, and stay connected, guys. And Mike, thank you again.
Yeah, thank you. All right, so I guess we'll wrap it up there. I don't see any other questions coming, nothing but kudos for you. So
Jen, thank you so much. Thank you everybody for being here. You made my night, made my week.